Respiratory Therapy, Lesson 8, Modes of Ventilation 2. This unit covers the basics of respiratory therapy. The goal for this lesson is to understand the three basic modes of AC, SIMV, and CPAP. This is the content of this lesson. In the previous lesson, we learned about PCV and VCV of controlled ventilation. In this lesson, we will learn about AC, SIMV, and CPAP, in the vertical columns of the table. Please note that CPAP is referred to as PSV or CPAP plus PS only when PS is configured together. First, we will describe AC mode. AC mode is called assist control mode and referred to as assisted or regulated ventilation, in which the ventilator provides mandatory ventilation for a set number of breaths. It is usually described as a mode to be used in patients without spontaneous breathing. However, recently there are also cases where AC mode is used in patients with spontaneous breathing because mandatory ventilation can be performed in sync with spontaneous breathing. Mandatory ventilation here means the delivery of regulated ventilation set by the ventilator. AC mode assists all spontaneous patient breaths sensed by the ventilator even if the frequency of the spontaneous breaths exceeds the preset frequency of mechanical breaths. The SIMV mode refers to synchronized intermittent mandatory ventilation, which provides a preset frequency of mandatory ventilation. When there is spontaneous breathing, the SIMV mode assists the breathing by a pressure support apart from the preset inspiratory pressure. The difference between the SIMV and AC modes is how each mode operates when there is spontaneous breathing. If there is no spontaneous breathing, SIMV will operate the same as AC. Next, we will describe pressure support as supplementary information. Pressure support, referred to as PS, is one of the settings that assists spontaneous breathing with a preset pressure. Spontaneous breathing with PS allows measurement of an increase in ventilation, and pressure support can reduce respiratory workload. Understanding PS may be confusing as it is described along with the modes and methods of ventilation, but you can remember the term as one of the settings such as inspiratory pressure and ventilation frequency. CPAP refers to continuous positive airway pressure, and is used with constant PEEP when there is spontaneous breathing. In other words, using CPAP in a patient without spontaneous breathing is contraindicated. CPAP can be supplemented with the addition of PS to assist spontaneous breathing. Also, with constant support by PEEP and PS, CPAP is used when weaning a patient off the ventilator. As supplementary information, PEEP refers to positive end expiratory pressure and is one of the settings that can prevent alveolar collapse by applying a certain pressure during expiration. Prevention of alveolar collapse leads to improved gas exchange capacity, and thus oxygenation can be improved. As with the pressure support, remember PEEP is one of the settings such as inspiratory pressure and ventilation frequency. This is the end of Lesson 8, Modes of Ventilation 2. Make sure you've mastered the basic concepts before you move on to the next level.